Do you think every clinical trial needs a clinical trial associate? The answer is no. There are clinical trials that are mostly focused on behavioral interventions. For instance, there can be computer based training to respond to aggressive behavior by patients within the healthcare setting. That kind of a clinical trial, which is focused on reducing workplace violence in healthcare setups, will not need a trial associate. It may, at the max, use a research assistant drawn from within the workforce to manage the logistics and the delivery of the computer based module, the online training module. But a clinical trial associate is needed to serve in administrative roles and in multiple levels, at multiple levels of the whole trial management process, mostly when pharmaceutical companies are involved. So that's one thing to keep in mind. Just because you see a trial being advertised, do not assume that there's a position for you. Secondly, it's important to understand what kind of a product is being trialed. Is it a device? Is it a medication? What is it? And it's important to be prepared for answering any kind of questions that the participant you're interested in recruiting may ask you. So you may not have a background in medical sciences, you may not have a background in nursing. But if that's the patient facing role that you are expected to fulfill, then understanding the device, the medication is important.